Welcome back, everybody. Time is running out for the annual open enrollment period on healthcare.gov. The deadline is coming up January 15th, and today, Mike Berteau, a healthcare economist, is here to remind us all about enrollment and who needs to do so like myself. Mike, happy holidays to you, my brother.
Oh, what a great day it is to be here with you, Marie.
Yes,
Thanks
it
for
is.
having
And
me.
look, what's the best gift someone can give somebody and yourself? The gift of healthcare. And look, last time you were here, we were talking all about Medicare. You made it very easy. See what I did there?
Thanks.
And today we're talking about everybody under the age of 65. Okay, look, there are some different groups we need to talk about. What do we need to know?
Well, we need to know that we're in open enrollment on healthcare.gov, which runs all the way to January 15th. Now, not everybody gets a wonderful offer of coverage from their employer. And we know a lot of dependents and spouses nowadays are getting offers from employers that are a little bit too expensive for them. And there is a path for them now to go to healthcare.gov to shop for individual coverage and to draw down lots of federal assistance to help pay for their premiums and their cost sharing. And so we want to make sure everybody knows that's an option for them.
Absolutely, and of course, like he mentioned, it does end January 15th, and then coverage starts on February 1st. Mardi Gras time. Look at that, everybody. Now, last time you were here, we also talked about Medicaid and how the government was really cracking down on people who maybe didn't qualify for Medicaid, but were on Medicaid. What do they need to know now that they maybe have gotten their pink slip?
That's great. You know, we need to remember that in May of 2020, we had almost 400,000 people in the state drawing unemployment.
Wow.
So that expansion of Medicaid turned out to be a critical thing to keeping people covered here in Louisiana. But now, starting in May of 23, they ratcheted back the coverage and started checking people's eligibility again. And about 200,000 people already have been removed from the Medicaid rolls. And we want to let those people know, step one, look on the back of your Medicaid card and call that number because you may be able to re-enroll. Step two, if you can't do that, check with your employer because most of those people now are back at work and they should have coverage through an employer plan.
Absolutely.
Step three, healthcare.gov. You want to get on the website and shop for individual coverage with federal help. Failing those other two options. We want to get those people back covered.
And Congress has done a few things to help more people qualify for that financial assistance, right?
Absolutely. A few years back, they multiplied the amount of financial assistance available to the point now where I have clients, friends with six-figure incomes who are getting 30, 40, 50% of their premiums covered by healthcare.gov.
Really?
So it's extremely generous. If you haven't shopped on healthcare.gov in a while, this is a really good time to go take a look.
And it's just not for individual everybody, it's for families as well. They have options for them as well. But I gotta ask you this, because you know, when you come on, I've already done my open enrollment, I'm covered for another year.
Woohoo.
Shout out to my employer, woohoo. But when you're on there trying to figure out what plan to get, it can be difficult, but you have this wonderful saying, the 3 Ps, which I
Absolutely.
love so much. Please remind everybody what the 3 Ps are.
It's critical when you're shopping for health insurance to check the 3 Ps. The first one is provider. That means your doctor. Make absolutely sure the doctor you want to use and the hospital you would use are covered in the network of the plan you sign up for. Sometimes you might see a plan with a premium of 0. And you grab it, and then you find out none of your doctors, none of your hospital, nobody's in there that you can use, so don't want that. The second thing is prescriptions. If you're already on some medication, you want to make sure the plan will cover the meds, and you should be able to find out what your copay is going to be before you sign up, so you don't get ambushed at the pharmacy. And the third one, we talk about extra little benefits that can come from that. It's just a nice idea to have a company close by so that you can pound on a desk when things don't go your way, so you've got an easy website and phone number to reach out to. All of these things make that health insurance easier to pay for, easier to use.
And what's great about Blue Cross Blue Shield is that you all have this number that people can call if they need help, because again, it's very difficult. There's a lot of health jargon on there that if you're not a healthcare provider or in the healthcare system, you may not understand. But you all also have a YouTube channel where I hear there are some videos featuring the one and only Mike Berteau.
Yeah, if you go to our YouTube channel, BCBSLA, you will find a lot of helpful videos covering all the different types of health insurance and programs so that people can ease that transition. Also, don't forget agents. There are licensed agents all over the state that we are working with day after day after day. They've been through this process. They know how it works. Don't try to go it alone. That's my advice.
And dare I ask you, Mike, if they missed the deadline of January 15th, right? What happens?
Well, there are special enrollment triggers you can access during the year. So if you lose your Medicaid in April, let's say, you don't have to worry about open enrollment. Healthcare.gov will let you enroll when you lose that coverage. If you lose coverage at work, if you have a baby, if you get married, if you move here from another state, there's a long list of special enrollment triggers that you can access through healthcare.gov during the regular year. So don't give up just because you missed January 15th.
Come on, that's the date to remember, everybody. Mike, thank you so much for being here.
Great to
Happy
see you.
holidays to you, my brother. And look, everybody, if you want more information about the healthcare options, log on to getplanoptions.com. And of course, you can also call them. All that information is on that website. Stick with us, everybody. We'll be right back with more Great Day Louisiana.